HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. The heartbeat of Staten Island University Hospital, Dr. Mitch Weinberg, sits down with three of the leading female cardiologists to discuss heart health for all Staten Islanders. Give it a listen.
Welcome to HealthWish. My name is Mitch Weinberg, and I'm the chair of cardiology at Staten Island University Hospital. I'm here at the above rooftop at the Nicotra's Hilton Garden Inn. And with me are three amazing people, all of whom I had the honor of hiring. So let me make some introductions. Supreeti Behuria, our director of nuclear cardiology, Jessica Bjorklund, our head of vascular medicine, and Samantha Lee, our head of telemetry and person who runs our cardiology fellowship program. Tell us a little about yourself, Supreeti.
I'm the director of nuclear cardiology. I'm also a preventative cardiologist, and I love women's heart health.
So just to give us a little reference there, so who gets a nuclear stress test?
If you come to see your cardiologist and you're having symptoms that are concerning for blockages in the arteries of your heart, we order a nuclear stress test to give us a non-invasive way to figure out whether that could be the case or not.
All right, excellent. Well, welcome.
Thank you.
We're looking forward to hearing more about that. Jess, tell us a little bit about yourself.
Hi, so I am a cardiologist at Staten Island University Hospital, and I practice general cardiology, but my specialty is vascular medicine. So I tell my patients that I focus on the blood vessels from head to toe and focus on keeping those vessels healthy.
Vascular disease, do we see a lot of that on Staten Island? Is it common?
There is a huge population of patients on Staten Island with vascular disease. Unfortunately, a lot of it is undiagnosed because it's not very well known. So I've really been focusing on educating the community and trying to teach people what is vascular disease, what could be causing it, how do I diagnose it, and how do we treat it.
Samantha, how about you?
I focus mainly on people who are in the hospital. So when your loved one comes to the hospital, they come to kind of our brand new floor in Staten Island, and we take care of them there. And so I see patients that have valve problems, patients that have heart failure, patients that have heart attacks, kind of any cardiac condition, we'll take care of you. And that's what I do part of the time. And then the other part of the time, I really focus on the training of our fellows. So we have 12 cardiology fellows, and that's kind of keeps us as cardiologists on our toes because they're learning. We always want to teach them kind of what's most current, what's most relevant.
But tell us a little bit more about yourself. Where did you grow up, Supreeti?
I kind of grew up all over the world. So I was born in India, grew up in the Philippines, moved back to India, and then moved to the States when I was 17 for undergrad.
How about you, Jess?
So I'm from the Midwest. I lived in several states throughout the Midwest, Oklahoma, Missouri, Minnesota. And then as I went to university, medical school, I started moving further east, and I was in Chicago for some time, and then I ended up in New York for my cardiology training and decided to stay here and call this home.
Sam?
Born and raised in Queens, and I've kind of bopped around New York, been in Manhattan, been in Brooklyn. You probably know my dad worked for the MTA, my mom's a school teacher, so I feel really at home here with the community we have in Staten Island.
You know, it's a little unusual. When I came to Staten Island, what I had heard was that all the doctors on Staten Island were from Staten Island. Yet there's a theme here that seems quite different. So explain for that. What are you doing here, Sam?
I don't know. I ask myself every day. No, I came here because I think there's really great opportunities in Staten Island. I think it's a really large population, and we have all the resources in cardiology to take care of them. And it was exciting when I was looking for jobs to join a department where we are bringing all of the advances in cardiology and bringing it to Staten Island. And so I think there's just so many ways in which our department is expanding and growing and really delivering great care to the patients, and I just wanted to be a part of that.
What about you, Jess?
There are several reasons for why I decided to come here. I was already part of the Northwell system on Long Island, and I enjoyed working there. But as I trained in my vascular medicine subspecialty, I realized that Staten Island had a lot of vascular disease that needed to be diagnosed and treated. And so I was very happy to be able to come here and start a vascular medicine program.
Supreeti, you've seen the whole world, and now you're on Staten Island. What's that like for you?
Well, Mitch, it's actually very wonderful. I think I started at Staten Island after all of you. I think what drew me here, firstly, is your enthusiasm to build a great cardiology program here. And then I met people like Jess and Sam in my interview. And honestly, not a single day feels like work here because we've all become a family. My favorite thing about Staten Island Cardiology is the people. A lot of us young faculty live around each other, so we hang out a lot after work.
So you would say that potentially you all could be here for a while?
Yes, of course, that's the plan.
Yeah, you better.
Isn't that the plan for us from your end?
That's the plan for everybody.
Yeah.
Okay, excellent. How about you, Sam?
I mean, I think we work with great people, and it forms good relationships that kind of help us take care of our patients. So as an example, Greg Maniotis, our structural cardiologist, it's really easy for me to just call him and kind of reach out to him during the day and say, hey, I have a patient, this is what's going on, what do you think? And we discuss the cases. And I think having those really close relationships, those friendships with your colleagues, allows you to feel comfortable reaching out to them, and it allows you to take better care of all your patients.
So it's not just work, it's family, it's a beautiful, it's fun, it's beautiful collaboration. Jess, how do you see it?
So for me, it's being part of the team, and it's not just the doctors, but it's everyone in the office that makes it a family. For example, when I started 2 years ago, I didn't know any of my patients, but the office staff had been there for years. And it's the medical assistants, the schedulers, the nurses who work with us, the nurse practitioners. It's just a big family.
Well, we're not just providing great care, but we're really reaching out to the community in a unique way. And that's quite different than I think other cardiology programs throughout the country. We're not just sitting in an office, we're not just sitting in a hospital. We are in a lot of other places delivering knowledge and really letting people get to know us as people. I know that all of you have been a part of that. I want to hear the favorite thing that you did in line with that kind of mission.
One of the really cool things that I get to do at work is I get to, for instance, go to a high school and talk to 16-year-olds about what it means to work in the hospital. And not just what it means to be a doctor, but you could be a nurse, you could be an echo tech, and kind of show them what we do and how we work together. Or, we spent one Sunday going to a church, and it was really amazing. We got to go to their sermon, we got to be kind of a part of their community, and then at the end, talk to them about heart health, about healthy living and preventative measures for, avoiding some of these cardiac conditions in the future. And I think that's a really cool thing that's a part of my job that I really enjoy.
So one of my memorable events since I started was when I had the opportunity to go speak to a group of women who are part of a Staten Island chapter of SOAR Optimus International. And it was during the month of February for Go Red for Women, and they invited me to come and speak about women's heart health.
What is SOAR Optimus for those who don't know?
So it's a group of very strong women who are helping girls and young women. And so at this event, I met judges, teachers, community workers, and I was able to learn more about them, what they're doing in the community, and also talk to them about women's heart health.
My favorite event so far has been when I was given the opportunity to speak to a group of older women who had retired, and speak to them a little bit about their risk factors for heart disease, when they should see a cardiologist, basically talk to them about getting care.
So, women's heart health, clearly a major topic of the day. And we are all a part of Staten Island University Hospital, and we're all a part of Northwell. And the CATS Institute is an institute that is really focused on advancing women's heart health. Tell us about the institute itself, who's a part of it, and what do they offer?
So of course cardiologists are, but obstetricians, endocrinologists, different surgeons as well. It's a whole host of physicians that are part of it.
And not just women, but also male physicians are a part of the Institute. I, for example, am a proud member of the CATS Institute. It's a great transition, speaking to women and caring for women. Why is that important? Why is that important to people?
Well, heart disease is the #1 killer of women. And a lot of women don't know that. Women think that breast cancer is the #1 killer of women, but heart disease kills more women every year than all cancers combined. And it's important for women to know that because 80% of heart disease is preventable. So no matter what your risk factors are, if you work with a cardiologist and with a team of people like we have at Staten Island, you can work to prevent heart disease.
That was a good answer.
You can't beat that. Now, you're a vascular specialist, right? Tell us about vascular disease in women. Does it present the same way in women as it does in men? Or when you're treating them, do you have to think differently?
I often find that women try to explain their symptoms off and not attribute it to something that could be going on, like, such as their blood vessels. This is just old age. This is just my joints. And I'm okay. I'll be fine. I'm getting older. Let me just push through. And talking to them, teasing out their symptoms, finding out what's going on, I'm able to say, okay, it could be you getting older, but let's check first and make sure that there's nothing else going on.
When we think about a heart attack, for instance, I think of those aspirin commercials where there's a guy who's in his 60s kind of clutching his chest and keeling over. And I think women present differently, but women can also have dizziness or nausea or kind of more like feeling like there's something wrong with their stomach, those complaints. And I think that's why it's so important to educate women on their health.
In the community, we've heard a little bit about vascular disease. Coronary artery disease, as we mentioned, is very common, can be very dangerous, and requires us as a field, it requires our focus. How do you assess people for a coronary artery disease? How do we diagnose it? What kind of symptoms are we really looking for?
So coronary artery disease is when you have blockages in the arteries of your heart. And a heart attack happens when one of those blockages breaks off and it decreases the oxygen and blood supply to the wall of your heart. The way we diagnose it, firstly, is talking to patients about symptoms. So chest pain, difficulty breathing, a decrease in exercise tolerance, feeling more fatigued when you're doing simple activities. Those are kind of the symptoms that you look out for. And then you talk to patients about their risk factors: high blood pressure, high cholesterol, diabetes, a family history of heart disease. Once all those things come together, you choose the right test for your patient.
Give us some options.
You could do a stress test for your patient, which is walking on a treadmill and then taking pictures of your heart with an ultrasound or a nuclear camera, which we do in nuclear cardiology. Or you could do a CAT scan of the arteries of the heart to see where the blockages are and how severe they are.
You know, we've heard a lot about CT, CAT scan technology. We on Staten Island have invested a tremendous amount of resources in advanced imaging. You treat a lot of patients in the hospital, Sam. What does a CT angiogram of the coronary arteries give you? What does it teach us?
I really love the test because it gives me a lot of information. So basically we send the patient to a CT scanner, and while they do that, we give them contrast. And that contrast actually goes down each artery. And when we look at the images, we can actually see what the arteries look like. So if there's a blockage, we'll see that blockage on our images. And for those mild, moderate people, we might just treat them with medications, and then they'll see Supreeti in the clinic, and she'll kind of work on their blood pressure and their diabetes. Or if it's more severe, we might have them stay in the hospital, and then we'll send them for a stent. And so it really gives us the opportunity to look inside the body in what we call a non-invasive way.
It almost sounds like it's as good as an angiogram. How do you compare it? Should everybody get a coronary CAT scan?
So it's very good. So it really depends on why you're seeing a cardiologist. Are you seeing a cardiologist because you have some of the symptoms Supreeti described? Then it might be appropriate. It might be appropriate if you have a really, really high family history of coronary artery disease and you yourself have diabetes and kidney problems.
We've really focused on heart failure in Staten Island, and also because there have been tremendous advances. How do you see that, Supreeti?
Well, for example, in Staten Island, we have Dr. Rojas is our heart failure specialist. He works with a team. They get advanced technologies. For example, we have something called a CardioMEMS, which is a wire that sits in the heart and lets Dr. Rojas know via computer technology whether they're a little bit volume up or not and they need some extra medicine. So the heart failure field is really, really expanding quickly.
And we actually just doubled the number of heart failure providers on Staten Island. We added a doctor, his name is Spencer Liu, to our team, but he's focused on heart failure related procedures like ECMO. Tell us what ECMO is. When do we use that? What do you think, Jess?
So ECMO is for someone who's very sick in the hospital. So if their heart is giving out and their heart's not able to function anymore, we have special equipment that we will put into the body and help with the blood flow and kind of take over the heart's job while we help the heart recover.
Going back, I think one of the reasons why it's really great we're investing in heart failure is shortness of breath. I find a lot of patients don't realize it's their heart. They'll go to urgent care and they'll think maybe it's their asthma or their COPD, or they'll just kind of blow it off and say, oh, this will get better. It's just because I haven't exercised that much. But really with heart failure, shortness of breath is one of the key symptoms. And so I think that's one of the reasons why it's so great we're investing kind of our time and money and energy in taking care of these patients, because if you intervene early, they can improve, they can get better. Or if they're super sick, then we kind of have options to help them farther down the line, like a heart transplant or mechanical hearts. And so it's really great that we have both Dr. Rojas and Dr. Liu now.
What other symptoms should they be mindful of, the HealthWish audience?
Leg swelling is a big one. Waking up in the middle of the night, gasping for air, needing more pillows to sleep with at night.
One of the other symptoms that I ask my patients about is when you're eating, after you've eaten or you're starting to eat, are you getting full fast? Is your belly starting to hurt? That can be a sign that their heart might not be functioning as well too.
So, heart failure, we know now how to identify it. We know now where patients on Staten Island can go. We have all the resources that they need, and we'll get them there.
Join us next time as we continue the conversation with the Staten Island University Hospital cardiology team. HealthWish wishes to thank our special guests, Dr. Mitch Weinberg, Dr. Supreeti Behuria, Dr. Jessica Bjorklund, and Dr. Samantha Lee. Recorded at the above rooftop at the Staten Island Hilton Garden Inn. For more information on the Lois and Richard Nicotra Heart Institute and ways to give back, please click the link in the video description. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.